Alright, so when we're talking about cervical cancer, another little area to review of anatomy. Alright, this is our uterus. Alright, the cervix is the bottom part of the uterus that separates the uterus and closes it off from the vagina. Alright, so when we're talking about cervical cancer, we're talking about cancer that starts there in that area. Alright, so cervical cancer is an invasive cancer of the uterine cervix, and most commonly also spreads to involve the vagina, the parametria, and the pelvic sidewalls as well. In advanced disease, it can also spread to the bladder, rectum, and other pelvic sites. Alright, prognosis varies depending on how early we can catch it. Alright, and we catch it through pap smears. Alright, the earlier it's caught, the better the chance is of preventing mortality in our patients. So our main method of detecting cervical cancer, because it's usually asymptomatic, is through a pap smear. And this is why it's recommended for women to get regular pap smear screenings according to the guidelines established with them and their gynecologist, right? And in a pap smear, what they're actually doing is they insert a speculum into the vagina and they use a swab to take samples of the cervical cells. And then they take those cells and they look at them under a microscope, usually by a pathologist, to determine if they're abnormal. Right. Cervical cancer has a very, very strong association with sexually transmitted diseases, especially HPV or the human papillomavirus. There's other risk factors as well. There's early coitus. That means they start having sexual intercourse and sexual activity at a young age. If they have multiple sexual partners, have unprotected sex, any other history of STDs, use non-barrier methods of birth control, are of low socioeconomic status, have a high parity, now that means that they've been pregnant multiple times, smoke cigarettes, have immunosuppression disorders of some kind, or if they don't regularly get pap smears. Right? Because it is so strongly associated with HPV as our number one risk factor, this is why the vaccine Gardasil that protects against certain strains of HPV also prevents cervical cancer. Right, the majority of cases are invasive squamous cell type. Right, other types are adenocarcinoma. Right, it arises from some type of dysplastic lesion like genital warts. Right, that already causes dysplasia changes to those cells. So think back to our very first talk about cellular changes. And remember, if we have dysplasia cells, they're the precursor to cancer cells, and they can morph into cancer and tumors. Alright, so what happens in sexually transmitted diseases most often, alright, that cause lesions, specifically genital warts, right? That causes the cells to mutate into dysplasia cells. Right? They can then mutate into cancer cells. The cancer then spreads from lymph nodes in that area, right, and can go from blood vessels to the bladder, as well as the ureters, the rectum, and even distant organs. Right? That's why we want to catch it sooner rather than later. Right? The most specific strains of HPV that are considered oncogenic, meaning cancer-causing, are HPV 16 and 18. Right? They're also the most common type that causes genital warts. Right? HPV, the genital warts, the medical word for them are condylomas. Right? Gardasil also protects against these strains, and that's why it's important that we recommend for any teenager or child who is sexually active, right, or even later in life if they haven't had it before and they're now sexually active, to get the vaccination. Right? HPV is a viral oncogenetic cell that releases a protein called E7. The E7 protein then inactivates the tumor suppressor genes in the cervix, which means that they then can't control overgrowth of abnormal cells, and that's where the dysplasia starts. And then over time, that dysplasia slowly progresses into an invasive cancer. Alright, so next up you'll pick up with uterine or endometrial cancer.